What's up, guys? Dr. Barrett here. Just diving in tonight, and we are speaking on the topic of depression and anxiety, natural solutions, and helping people overcome seasons of their life when they're depressed, or obviously if you're actually on the medication, antidepressants, anti-anxiety medication. Are those even validated by research to show that they even, correct the cause? So that's the stuff we're diving into tonight. Just remember that in the office, May 24th at 6:30 p.m., it's a Thursday night here at the Health Factory, is our Hack Your Brain workshop. So we're gonna be talking everything from depression, anxiety, ADD, ADHD, autistic spectrum, Alzheimer's, dementia, everything in between, just how to create a healthier brain, how to create a healthier brain in your children. You as a mom, maybe at 40 years old, how to maximize your brain power, and then how to obviously prevent neurodegeneration, neurodegenerative conditions in the future. So I was in the office the other day, and someone just mentioned, a patient of mine mentioned that he really loved the videos, and he knows that we were in a Hack Your Brain workshop series. So he said, "Hey, Dr. Barrett, can you put something out there for us on this concept of depression, anxiety?" He's been on antidepressant for a while, and just wanted to hear our thoughts on it. So that's our main focus here tonight. We do see, unfortunately, a lot of patients on antidepressants, anti-anxiety-based medications. And we know the risks of them. We know that they increase suicidal tendencies, homicidal tendencies. We know that, we look at every school shooting done by a child. They were on some type of psychiatric-based medication. It's heavy, but it's absolutely real. And we have to talk about it. We have to talk about what's causing it, what are natural solutions, that we can create an active, powerful, well-balanced brain. So there was a cool testimony from a patient of mine who was on a few different antidepressants, anti-anxiety, sleep medications for a number of years. She came to the office. We started doing a lot of work on her and got amazing results. Started getting her adjusted and influencing that brain from a chiropractic adjustment. We started to heal her gut, and she came off medication, was doing amazing. She ended up having a couple babies at the same time. Yes, that's called twins, and rocked her world, but had an overall amazing pregnancy, and then just recently started to have some of those depression, anxiety, OCD type of symptoms come back. So most people look for a pill. What supplement can I take? And I get it. There are supplements that do amazing things. But if we're eating clean and taking care of our stress levels, for her, we started to do a lot of brain rehab on her, right? And so what we found for this case was what worked for her in the past in terms of gut restoration and stress reduction. She was just not firing on all cylinders upstairs. So we started really activating her cerebellum. We started doing some complex movements, started to really get her brain firing. And it was amazing. She couldn't even really hold a posed position on one foot, very unbalanced, uncoordinated. And as soon as we started getting that active again and activating the cerebellum, some complex movements, man, everything just started coming on. Their brain just turned on. Immediate, less anxiety, sleeping better, not depressed, no OCD tendencies, and she's just been doing incredible ever since. And so it just goes to show you that the brain is powerful in its ability to heal and get turned on. And so that's the subject matter of tonight is what's the cause? What do we see clinically as the cause of depression, anxiety? It's multifaceted, and so tonight we're really diving in, right? So because even right now in our U.S., when we think about depression, we prescribe drugs. and it's built off of a chemical imbalance model. It's never been validated in research. There is, the U.S. as a whole consumes more antidepressants than any other country. 10% of the population, 1 out of 10 people are on an antidepressant, and 40% of women between 40 and 60 are on an antidepressant, right? And so we are slugging these medications for typically months and years. And again, unfortunately, the reality is there is no validation in research to show that these medications are doing anything beneficial for our brain. And most of it is, the reality, harmful to our brain. Very, very harmful. The research shows that antidepressants as a whole, under study, that literally the placebo effect in many studies had a greater than 30% improvement over those that were actually on an antidepressant during the study. That the reason that we look at research in general for antidepressants is to understand that there isn't anything out there that validates that antidepressants are, again, doing anything beneficial for the brain. And so I kind of liken it to if you go to the medicine cabinet because you have a headache and you take aspirin and it takes your headache away, was it because God put a need in your body for aspirin? Was it because you just don't have aspirin in your body and so you need it, obviously, to correct the headache? No, you didn't. You don't have a headache because of a depleted level of aspirin, right? You have a headache because of other reasons, but the aspirin helped the headache. There are times where antidepressants, anti-anxiety-based medications help you and you feel better, but does it mean that antidepressant, anti-anxiety medication is curing the cause? And there is no research that shows it actually is doing that at all. And you may temporarily feel better because of huge surges of serotonin to the brain or huge surges of dopamine responses. You may temporarily feel better, but again, over the life, these medications are wreaking absolute havoc on our brain and our nervous system. So the big theory is off of a chemical imbalance. So if you're low in serotonin, you need more serotonin. So you take a SSRI, a selective serotonin reuptake inhibitor, which floods the brain full of serotonin, which is an inhibitory neurotransmitter, and inevitably, can help you feel better. But that, again, isn't validating that, the cause of your depression is low serotonin. All right. So tonight we're going to give you a new model to understand depression, anxiety, and why we see it as being so prevalent and what you can do immediately to start solving it. And we're gonna dive into this way more in detail in the coming weeks at our May 24th workshop. So remember that tonight's just kind of scratching the surface. So our model is more of a depressed versus active brain model. So what that means is your brain is either in a depressed state or it's in a heightened awareness active state. And it's one of the two, and obviously there's in between, but from a general model standpoint, your brain's either in a depressed model or an active model. And so what we see is even on neuroimaging of the brain in patients that are depressed, we see literally a smaller sized brain, that the amygdala, which is emotional regulation, emotional response, is smaller. We see the hippocampus is smaller, that's associated with emotional memory. We see the prefrontal cortex is smaller, which is associated with emotional regulation. So we see actually the brain itself is smaller, which means it's not active, it's not being stimulated, it's not being driven. And so that kind of validates this idea that the issue is more of activation than it is anything else. So what we want to propose to you tonight is how do you activate your brain? So we're going to give you 4 strategies to create a more active brain that will directly benefit you and make you feel better, but also correct the cause, correct the core issues that we see associated with depression and anxiety, okay? And again, we're gonna dive way more in detail about this in a couple weeks, but let's touch on it real quick to give you guys some info on it. So the first one is your gut health. Your gut health is absolutely essential to the health of your brain. Your brain and gut are connected more than you could ever realize. Think about when your stomach bothers you. When your gut bothers you, you just don't feel good, right? You don't feel like doing anything. You feel depressed. You feel low energy. Your gut is incredible in its ability to regulate how you feel and then obviously how you function. One, the gut-brain connection is designed off of the vagus nerve, which comes out of the brainstem and parasympathetically activates your digestive system. It causes motility and peristalsis, movement, and stimulates activity of the digestive system. The gut in of itself is called the enteric nervous system. It's its own separate system. It's actually called the second brain. And it's amazing that you look at the half a billion neurons in the digestive system, you realize how amazingly connected it is to the brain itself. There is research, and this will hit you. Have you ever had an antibiotic before? That's a question. All right. Well, what about just 5 rounds of antibiotics? Have you ever had 5 rounds of antibiotics? If you've had 5 rounds of antibiotics because of as a kid, you came out of the, as soon as you delivered into the world, maybe your mom was an IV antibiotic, or you were 6 months, got antibiotic for ear infection, or 12 months old, got antibiotic for sinus infection, or you're on multiple antibiotics as a kid because of colds and flus that they just threw at you, because that's what they do in walk-in clinics and most doctor offices. They just give you an antibiotic. So 5 antibiotics. That doesn't even mention, that's rounds of antibiotics. That's not even going to mention what's in our food source. That literally like glyphosate. That's a pesticide. It's also an antibiotic. That's in practically all of our food. Imagine how much antibiotics is in our food source. So when you think about, have you ever been on 5 rounds of antibiotics? Yes, you have. More than likely you have. If you have, ready? You have just increased your risk of getting depression. 50% is what research validates and shows. 50% increase in depression by just being on 5 rounds of antibiotics. How does an antibiotic cause depression? Because it does. It's a direct correlation. How does it cause it? By affecting your gut, by affecting the microorganisms of your digestive system. And that's amazing to me, that an antibiotic can literally put someone in a depressed state that unfortunately that they end up going to the doctor and getting medication for. And that medication's side effects are, because they have to black label it, suicide, homicide. We have a patient that just recently started under care, a young girl who went to a psychiatrist, was immediately put on anti-anxiety medications when she was younger. She was anxious, and then that led to suicidal tendencies. So then she was put on an antidepressant, Prozac, that increased the dosage to the point where she is trying to commit suicide on a regular basis. And she came to the office, did a simple evaluation, and we found out that she has some orthostatic tachycardia, so like POTS is what we call it. Never been tested, never had a proper evaluation. That literally is creating that anxiousness, that dysregulated brain and autonomic nervous system. That to me was amazing. That just based on a symptom, they put her on a medication that has led to suicidal attempts. And we see this every day, guys, every single day. Even my own mom, after years of antidepressants, anti-anxiety medication, sleep medication, committed suicide. So it affects me just as much as you, and obviously a lot of my patients. And so My passion is to help you. My passion is to help you understand that it's not as simple as just getting on a pill, even though you temporarily may feel better, because that pill is completely dysregulating your brain function. So how do we solve it? It starts with the gut. It starts with activating the second brain, getting the digestive system healthy. 90% of serotonin, if you need more serotonin, get a healthier gut. 90% of serotonin is actually in the digestive system. That's amazing. That prebiotics, those are what probiotics actually feed off of. A lot of times we hear probiotics, which is bacteria, but bacteria need fuel, and that's fuel is what we term prebiotics. Prebiotics are like a carbohydrate that bacteria feed off of. Well, prebiotics have been shown to be as effective as an anti-anxiety medication. So literally taking prebiotic fiber is as effective as anti-anxiety based medication. Amazing that it decreases your cortisol production in the morning. And that is usually associated with you coming out of, coming into the world, waking up in the middle in the morning when cortisol is supposed to be the highest. Yours can shoot way too high and leave you waking up in early morning feeling anxious. And then we stimulate that anxiety even more. We stimulate the anxiety even more by taking caffeine, which is driving a greater adrenal cortisol response and driving more anxiety. And so as simple as prebiotics can literally be life-changing for you. But just regulating the gut in general. Microorganisms, bacteria, activate the vagus nerve. They activate that parasympathetic nerve that helps drive connection between your gut and brain. Amazing. Again, that's how powerful the brain is, or the gut is, in its ability to heal the brain through microorganisms, prebiotics, and just general good gut health. You can transform the health of your brain and nervous system and feel better and actually get to the root issue of why you're feeling bad. So that's anxiousness, that's depression being solved through digestive measures. The second thing we can talk about is genetic defects. So the first one was gut, the second one is genetic defects. So genetic defects that we all hear about now is like the MTHFR gene. And listen, I'm all about supporting genetic defects and genetics in general. So, but you are not necessarily, we're not subject to our genes. Our genes can be turned on or turned off and regulated by our environment. And so one thing that this whole MTHFR system does in a very simplified way is that it affects the production of serotonin and dopamine. And so those are two essential hormones in helping you feel good and feel great, have mental acuity, sharpness, and just balancing overall your neurotransmitters. So this genetic defect is obviously there, but the solution isn't just, hey, let's pound a bunch of methyl B vitamins. I have a patient right now that's in the office that it's definitely better than any other medication, but she's on 15 milligrams of Deplin, which is a antidepressant. And guess what that antidepressant is? It is methylfolate. It's a methylated B vitamin. That's all the medication is. So nowadays we're starting to realize how vitamins, minerals, nutrients play a role with how well our body and brain is working. So a medication, Deplin, is inevitably helping people feel better and create some functionality of the brain. The problem is 15 milligrams of methylfolate is, in my opinion, way too much, too hard on the brain without supporting other areas. I think gut is the most important thing to start with first, and then we can start activating the methylation cycles and systems through proper methylation support. Don't do it on your own. Don't start slamming down 10 milligrams of methylfolate, please. You got to go see someone that's going to help you understand more about your methylation system and support these B vitamins properly. But yeah, when this genetic defect, if you're MTHFR homozygous, heterozygous, as well as there's other genetic defects, COMT, the MAO system, all of these other SNPs that are commonly in us that could be activated by our environment. Guys, we can regulate those again. But again, I wouldn't suggest just going off and slamming a bunch of pills, whether they're natural or not, to help solve that issue. But number 2 is proper methylation support can be huge in helping your body produce more serotonin and dopamine properly, or regulating the production of it, which is a better term. The brain is a symphony. It's not about how much or how little, it's about how balanced the brain is, how balanced the neurotransmitters are. That's the way the body's designed to work, okay? So the first one's gut, second one's B vitamins through MTHFR support. The third one is the stress system of the body, the stress adrenal system, right? So if we're constantly overstimulating our body, we're gonna be in an anxious state. If we're producing too much cortisol, like I mentioned before, that prebiotics can help lower cortisol production, then we're gonna be anxious. Also, the adrenal system secretes epinephrine, norepinephrine, or adrenaline, noradrenaline. It's responsible to get us up and keep us alert, but due to adrenal fatigue, a dysregulated adrenal system, we could have a couple big issues that arise. The first is we could have hypoglycemic reactions. We could have low blood sugar. And when blood sugar is low and dysregulated, there's an amazing thing that happens. We don't get amino acids to our brain. Yes, so if you're diabetic, you're typically going to be having deficiency of brain amino acids. If you feel hypoglycemia, which is like bottoming out of your blood sugar levels, you are not getting amino acids to your brain. Phenylalanine, tyrosine, tryptophan. These amino acids are not going to your brain. It needs stability of blood sugar in order for your brain to properly get amino acids across the blood-brain barrier and used to create serotonin and dopamine and many, many other neurotransmitters, okay? So a properly functioning adrenal system that's not secreting too much cortisol, that's regulating blood sugar and regulating stress, will inevitably lead to a healthier, happier brain. Gut, B vitamin support through MTHFR genetic defects. Adrenal system, man, we've talked through 3 big ones. The fourth one, Dr. Caleb, one and me specifically talking about tonight, is movement. Yeah, he's huge on movement. I'm huge on movement. We're all here huge on movement. That's why there's a CrossFit gym at the Health Factory. We're all about functional movements and moving the body. But here's the focus of this, okay? All right, frontal lobe activation. We need to consciously decide to move. When we consciously decide to move, so we make the decision consciously to move, we get frontal lobe activation. Choosing to move and choosing exercise is what drives a healthier brain. Guys, your brain is set up in a priority standpoint, and it'll choose one and not do 2 things at once, okay? It'll choose one. So if you are going to, a perfect example, let's just say you hit your head. You bump it on the cabinet and there's pain. What's your immediate instinct? It's to rub it, right? And so what we're activating is proprioception. We're stimulating those nerves, and inevitably it feels better, like you're blocking pain. Movement blocks pain. Movement blocks depression directly. Research validated movement, conscious movement blocks depression. It's the best antidepressant, anti-anxiety medication you could possibly take. And if you look at the people that are depressed and anxious, they're the people that aren't moving. They're sitting down and their brains are not being stimulated. They have a depressed brain state. It's not being stimulated through the gut. It's parasympathetic activity. It's not being stimulated through movement. It's not being stimulated through nutrients. It's not being stimulated, guys. And so the solutions I know are simple because we trust the white coat. We trust the guy that you go see and he gives you the antidepressant, he gives you anti-anxiety medication, you're gonna feel better. But again, just because you took aspirin for a headache, that doesn't mean you need aspirin. And the cause of your headache was aspirin deficiency. Just because you feel better on antidepressant, anti-anxiety medication doesn't mean that was the cause. It may help temporarily, but long-term, it's not the solution. We know that. Short-term, it's really not the solution. And it's important to realize the cause is the cure. The cause is the cure. The cause, depressed brain state, decreased movement, decreased activation, poor gut function, poor nutrient consumption, poor lifestyle choices. We change those things and guaranteed you will feel better for the long haul. It's really that simple. Easy. Simple, but not easy. Right? Simple, but not easy. So that's the way to the better brain. That's the way to help conquer depression, anxiety. And trust me, I know where you're at. I know I'm not telling you to stop your antidepressants, anti-anxiety medication at all. That's not my goal tonight. That's not my goal at all. My goal is to help you understand more about how the body works and how to help solve the mysteries of disease. What you may not know isn't harming you. What you may not know is actually killing you. And so this is a perfect example of kids every day, adults that are battling suicidal tendencies, homicidal tendencies because of years on antidepressants, anti-anxiety medication. And one leads to two, two leads to three, and sooner or later you don't know how you got there. You just don't feel great. So we're here for you. We're here to help you. And more importantly, we're here to just give you information to help change your life. Whether you're in Knoxville or not, we appreciate you. We love you, and we're willing to help in your journey to health. May 24th, seminar here at the Health Factory, 6:30. We're talking about this and so much more. So if you need anything in the meantime, just give us a shout, let us know. But if not, have a great night, and we'll see you guys in a couple weeks.